Thank you, Lisa. What is it about home? I mean, here we are, enjoying our wine, the company of new and old friends and colleagues. I can smell the delicious dinner that we're soon to be enjoying. In fact, I think they're waiting for me to be over. But at the end of the day, with all the fun we're going to have, I bet all of us are going to be quite happy to go back home. I remember years ago, I took a trip with my mother-in-law, Stan's wonderful mother. And at the end of the trip, she said, you know, I've learned through the life that no matter how much fun you had, it's always nice to go back home. I personally never thought of that, but I have been thinking about it ever since. And it's true. I myself now have been on many travels, and it doesn't matter if you come home from a boring sales convention or an exciting vacation to the tropics. If you're coming home from a hard day at work or a fun party with friends like this one, going home always makes you feel good, doesn't it? And it doesn't matter, I realize, where the home is. For us, home has been Milan, Italy, Rybrook, New York, now Petaluma, California. It doesn't matter if home is the house where you raised your children or the wonderful assisted living facility you stay in. Home is where you find comfort. And home is the central of our life. And so if home is so vital for us, so too is home care. Most of us will agree that, yes, when we get old, it will be fine to have somebody to run your errands and to do some chores in the house. But my belief is that we must understand, there has to be an understanding of the real meaning of home care that has in the continuum of care. And I forgot my slides. Continuum of care is a client-oriented concept involving an integrated system of care that guides and tracks patients over time through a comprehensive array of health and social services spanning all levels of intensity of care. That's a definition. Notice the keywords there, client-oriented and integrated. And so when a patient leaves a hospital, the discharging nurse who communicates with the patient, if we want the care to be integrated, as many of you here know, you must at least make sure that there is a caregiver, sometimes a family caregiver, but it has to be somebody committed to help that person to continue to take care of themselves once the medical professionals are no longer there. And so if we really want to provide great service to our patients and our clients, we want to make sure that that caregiver that we identified actually is taking the responsibility of making those phone calls to make the appointments with the doctor, making sure that he or she takes the client to see the doctor, making sure that they explain the client what is to be expected, making sure that they explain the doctor what exactly is going on at home. I often hear daughters, because it's usually the daughter, isn't it, that takes care of their parents, say, you know, my mom, she really can put on her best face when we go to the doctor. And he believes her when she says everything is okay, but I know that's not true. Have you heard that before, Lisa? All the time. Why is it that way? I think doctors have a tendency to believe more and listen more closely to a professional caregiver, at least in my experience. at times that they have to an actual family member. Why is that? I don't know. Perhaps because it's another professional. Perhaps because professional caregivers spend more time with the elderly than their family generally do. Or probably because the professional caregiver is seen as an objective person, with an objective eye. So the continuum of care involves having somebody, as we said, who makes those appointments, but also somebody who documents, takes notes of what the physician, the nurse says, and makes sure that they follow through with picking up the medication, making sure that the client at home actually does take the medication at the right time, at the right dose. The American Academy of Family Physicians defines continuity of care as the process by which the patient and the physician are cooperatively involved in ongoing healthcare management toward the goal of high-quality, cost-effective medical care. Keywords here, patient and physician. That's all well when we are the patients. What about when the patient is in her 90s, perhaps with some dementia, perhaps with some depression, and is either unable or unwilling to follow the directions? Then where does the continuity go? Such a person needs a strong advocate, often seen in a professional caregiver, who will make sure, as we said, not only that the medications are taken, but the elderly client has regular nutritional meals every day, that she goes around taking that walk so that she can maintain her mobility, that her doggy is taken care of. One of the best services that caregivers provide is being a companion with whom their elderly client have conversation. And all of this is to maintain not only the body, but the mind at its best. So we were talking about benefits of in-home care. How many of you know that today is World Elder Abuse Prevention Awareness Day? Yay! That is why we have these purple bags. The purple is the color that they have chosen, which, by the way, is a color that we have also. We chose it with Virginia, our friend here. She's retired now, but she's a professional graphic designer. This is Virginia. And when we started our company, we sat together in our living room and decided, what colors do we want for our logo? And we somehow, for some reason, decided on purple and green, which I see many others in the field now are using, but we were the first ones, weren't we? At least we like to think so. And look at the beautiful logo that she created. Elder abuse is a sad reality. Unfortunately, what is even more sad is that elder abuse, financial and physical, but primarily financial, is done at the hands of those who are supposed to provide care for the elderly person, most of the times being a family member. Typically, a grandson who is abusing drugs, is having trouble in life. Grandma knows he's a troubled kid, but she feels sorry for him and opens her door, and he empties her bank account. I have to say that in our experience, we are not exposed to that much, and that is most likely due to the fact that our caregivers are in the house, and so people are discouraged from coming by, and so they keep an eye, monitor, and family members with bad intentions do not have that much access. However, I think it was a few months ago, one of our managers was exposed to a situation that was interesting. We were called by the daughter of an elderly lady. She knew that her brother, this lady's son, was taking advantage of the mom financially and also physically. In fact, there was a restraining order So she wanted to have a caregiver in the house so that he didn't have any excuse, any reason for living there. Once we got to do the assessment, he actually was in the house and became belligerent. We had to call the police, and he was arrested. Of course, we are mandated reporters, and reported it to Adult Protective Services, and the lady was placed to an assisted living facility. Although she would have liked to stay home, the reality was that her son had taken most of her money and she couldn't afford it. There are other situations. So the professional caregivers, what I meant to say is, are rarely involved in elder abuse, although there are cases. There are cases. But the reason is that generally the women, mostly, and men who choose this profession are driven by the great compassion and love for the elderly much more than they are for the greed. And as I want to point out to the fabulous team of our Sequoia Senior Solutions caregiver here tonight, you can see them in their purple shirt. They are truly an admirable group of people, and we're so proud of the work that they do. Thank you. These are an example of the compassion and love that I was talking about, and commitment and honesty. So when it comes back to the continuum of care, not only is it important for the elderly patient client to have help, but it means a lot how that caregiver is hired and selected. It's always safer, of course, if possible, to choose somebody who works for a reputable agency who does straight background checks and monitoring and supervision. But the caregivers, not only are they there to provide the services, and it's good if they're not taking advantage of the client, but their presence, as I said, can be the service of preventing for that person to be abused. And one example that comes to mind is of this client of ours, a lady in Napa. I think it was about a year or so ago, or longer. I remember she was in the bathroom, was cleaning the bathroom, and the client was in the kitchen on the phone. She overheard her elderly client giving the bank account number to the other person, whoever was on the line. So she rushed to the kitchen and was able to interrupt the communication. And of course, we called the family, and they canceled the account. So that was a good end of it. But can you imagine what could have happened? Yeah, incredible. Another situation, not all elder abuse is so dramatic, but because seniors are so vulnerable, and one of the reasons is that as we age, our defense goes down, and we become more trusty of other people. So I'm thinking of this couple that we had in Santa Rosa a few years ago. Both had some level of dementia, had been refusing help for many, many years, until we finally stepped in. And our caregivers found, among other things, I think it was 6 or 7 subscriptions to the Reader's Digest. Nobody was reading it anyway, and they had no idea that they had that many. So you think, okay, well, you place a phone call and you stop it. Much more complex than that. How you had that experience, it seems like. There were many different vendors that were involved, and the bureaucracy was phenomenal. But in the end, she managed to stop it. So, as you see, there are many aspects of in-home care. And while I believe that the healthcare in the continuum is certainly one of the most essential services, I mean, after all, that was my very first love and passion. I was a nurse, as was said earlier. It is, however, the continuum of care needs to include what happens at home as well. Caregivers are incredible professionals, and we need to make sure that they are included with other professionals, nurses, doctors, physical therapists, hospice, home health services, elder law attorneys, financial professionals, all of that should be included to provide a real continuum of care. The presence of a professional caregiver can be the key in allowing us to continue living in the place that has been the central of our journey of life, where we find safety, joy, and comfort. That is our own home.